Hello everyone, I'm Dr. Pratyusha from the Department of Pediatrics and Neonatology, Narayana Medical College, Nellore. World's Breastfeeding Week is celebrated in more than 120 countries worldwide in the first week of August every year. This global campaign aims to promote awareness regarding the utmost importance of breast milk and breastfeeding in the lactating mothers in the community. This year, the theme for Breastfeeding Week celebrations is Step Up Breastfeeding, Educate and Support. Thereby today, I would like to enlighten about the importance of breast milk and breastfeeding in the community. Breast milk is the greatest gift from the mother to the child. It is economical, sterile and readily available throughout the clock to meet the infant's needs. It is the sweetest milk which is high in sugars like lactose, easily digestible proteins like whey protein, casein, etc., essential fatty acids and several enzymes like lipases, oxidases, amylases which act as a barrier of defense against several microorganisms. It also contains the highly needed growth promoting factors and growth regulating factors. Breast milk is enriched with long-chain polyunsaturated fatty acids which are highly useful for the development of the brain. Also, compounds like lactoferrin ensure proper absorption of calcium and iron. Bioactive compounds like amino acids and immunoglobulins and various types of immune factors present in the breast milk like PABA, bifidus factor, etc. They confer high-grade immunity against various types of respiratory tract infections which can cause pneumonia and different types of gastrointestinal infections which can cause diarrhea. It also helps prevent predisposition to allergic conditions like atopic dermatitis. Colostrum is the first milk that is produced in the first 2 to 3 days after delivery. It is dense, yellowish and thick. It is highly enriched with proteins and immunoglobulins and is almost all that the baby might require during this period. Hence, early initiation of breastfeeding within the first 30 minutes after delivery is best educated and it can be continued to as long as 2 years after life. Most importantly, breast milk helps in establishing a strong emotional bond between the mother and her infant. Besides, it also has several benefits to the mother too. It helps in reducing the postpartum bleeding and also greatly reduces the risk of development of ovarian and breast cancers in these women. In toto, in a developing country like India, breastfeeding is a strategy which helps in reducing the overall burden of infant morbidity and mortality. So how often to breastfeed? There is no tailor-made schedule. Exclusive demand feeding is the most ideal. Well, breastfeeding can be quite challenging in the initial days of feeding for the mother. Sometimes there could be a sore and a cracked nipple. Other times the baby might not be able to latch on to the nipple properly. There could be breast engorgement because of overproduction of milk. Well, breastfeeding can be quite challenging to the mother in the early days. There could not be enough production of breast milk, the nipples could be sore and cracked, or the baby might not be able to latch on to the nipple properly. Sometimes there could be overproduction of milk, resulting in breast engorgement, making the breasts painful and tender. Other times, there could be a blocked duct, resulting in an inflammation and mastitis. In order to avoid these issues, firstly ensure that the baby is properly positioned and attaches to the breast well. Feed as often and as long as the baby demands. Offer both the breasts during every feed. In case the nipple is flat or damaged, using nipple shields can prove helpful. If the breasts are swollen or tender, using painkiller medications like paracetamol or cold compressors can help ease down the pain. Finally, the success of breastfeeding depends upon the positive mindset of the mother to feed her own baby. We have to remember that it's a shared responsibility of the community as a whole to promote breastfeeding. It is the best vaccine and there is no substitute for the same. Hence, it's a gift that lasts a lifetime. Wishing all the parents and mothers a very happy breastfeeding experience. Thank you.